All right, my friends, please prepare to be inspired. It is my honor to introduce our esteemed opening keynote speaker. A true powerhouse in the realms of marketing, healthcare, and community development, her expertise extends far beyond the boundaries of a single industry, making her a sought-after consultant in the fields of healthcare equity, social determinants of health, diversity and inclusion, and branding. Upon meeting, it is abundantly clear that our friend is a wizard at the art of market strategy, community programming development. But wait, that is not all. Currently, she serves as the Vice President of Community Engagement and External Affairs at Boston Medical Center. Our friend continues to blaze trails and make a difference in the lives of countless individuals. Her passion to create an impactful change, coupled with her exceptional insight and innovative thinking, has cemented her reputation as a true trailblazer in the healthcare arena. Brace yourselves for an extraordinary keynote address that will leave you inspired, motivated, and ready to make a meaningful difference. Please join me in a warm welcome to the incredible Patrina Martin-Sherry.
Thank you, Ross.
Much love.
Thank you. Hello, everybody. How's everyone doing? Oh, it is so wonderful to be here. Thank you, Ross, for a warm welcome and introduction, and to my friend Kendall. I'll tell you guys, so I met Kendall, I don't know, maybe it's been about a year ago. We were in a room filled with leaders across industry really talking about developing pathway programs. And so she and I were seated next to each other, and immediately, like, we clicked because we both love fashion. So we were talking about, oh, I love your purse, I love your shoes. But in a conversation, I found not just a true friend in her, but a true partner in this work. And so she and I are committed to get into lots of good trouble together. So thank you for inviting me here today. I'm really happy to be here. I see so many of my friends in this work and so many of my colleagues. So hello to everyone. But before I start, I want to recognize two really special people. If you know anything about health equity and the work that is being done, not just in Boston, not just in the Commonwealth, but around the country, you've got to know Dr. Thea James. And she is my friend. Yes, give her a hand because it is so well deserved. She is my friend and my colleague. She is my mentor. She is the person that on a really hard day, because you guys know this is hard work. It is hard work. Being in communities, seeing the needs, and then many times convincing people of what needs to be done. And it gets to be exhausting. I say to Thea all the time, this work lives somewhere. It lives in you, in your cells, and it's heavy. And she is the one that I go to on a daily basis just to make sure that I'm doing the right thing, that we're walking down the right paths, that we're fighting the right battles. And so I want to say publicly to her, I love and admire you so much. So thank you for all of your work. Thank you. And to my other friend, Sheila Facile, who you guys will hear on this panel, y'all, she is a dynamite. She's our Director of Innovation. She's amazing, so hold on to your seats. She's really, really incredible. People often ask me, give me a second one to get this going. People often ask me how I got started. Where are my glasses? Because when you're past 50, you need glasses. They ask me all the time, how did you get started in community engagement? How do you know how to engage communities? And I will tell you that I grew up in a rural town in South Carolina. And I grew up to parents who were community organizers. They were not college educated. My father didn't even have a high school diploma, but they were committed to creating, even in the 70s when I was born, they were committed to creating pathways for community members to excel and achieve. My father, you know, he had many jobs, but we had a farm. And so what that meant is that nobody in our community was hungry. So he was like, okay, I was 12 or 13 and driving. Yes, I lived in the country, but was driving. He'd say, Miss So-and-so needs some collards. Go drive this to her house. When it was an election season, both my parents were poll workers, and I was at 12, 13 years old going to pick up people and drive them to the polls. That is what community engagement is about, and it's really, really important. What you will learn when you're working in communities is that no matter what we do, We can never want more for communities than the community wants for themselves. And so the one thing that we'll continue to talk about today is the importance of community engagement, not just so you can get feedback on what you should be doing, but it's important because nobody knows better than the community what the community needs. And so I will try really hard today to stick to these slides that I have in front of me. So let's get started. Talent is equally distributed, but opportunity is not. And so if you look around this room, it's, fairly homogenous. Like there's some diversity here, and I think that's great. So if you think about talent and how talent is distributed, think of talent as a deck of cards, and whatever the universe, whatever God you believe in, when he or she is doling out talent, they give it out equally. The only thing that is different is access. Robert Lewis Jr., who is a really good friend of mine, if you guys don't know him, you should meet him, you should read about him. He is the president and CEO of the Boys and Girls Club of Boston. And he says all the time that when you are referring to kids in the community, like these aren't kids that we should be committed to saving. These are kids who are a talent pool, who all they need is somebody to open a door for them, to mentor them, to give them the things that they need so that they have access to opportunities. So just remember that it's really our goal and our mission to make sure that we are mentoring and sponsoring community members whenever at all possible. It's also important to be reminded that poor people are poor for a reason. People who are disenfranchised for a reason. Everybody knows what a redlining map looks like. Redlining really, it predicts life expectancy. It is the cause of, housing insecurities, the cause of environmental hazards, diabetes, cancer, incarceration. And just as redlining is a predictor of asthma, diabetes, and all those, it's also a predictor of life expectancy. During the COVID crisis, we looked at the data. It's called SVI, a Social Vulnerability Index. And Boston Medical Center was the COVID hospital. We had the most numbers of people who were sickest and dying of COVID. And so the Social Vulnerability Index was basically points on a map that told us the communities down to the street level where people were sickest and dying. And it should be no surprise that if you took that social vulnerability index map and you put it on top of this redlining map, it was exactly the same. It was exactly the same. And so when we as an institution at Boston Medical Center started to direct our focus on, where we were going to set up vaccination sites, it was very clear. And we'll get back to that. But there's a study, lots of studies, that basically show that 2 stops on the orange line is what it takes to erase nearly 25 years of life. The life expectancy on the orange line there's a 25-year gap in life expectancy. And so let's just think about that. If you think about health equity, if you think about inequities in general and where they are and why they exist, it's this. It's redlining. It's social vulnerability based on where people were disenfranchised, where they were excluded from housing, from jobs, from education. Boston Medical Center. People ask me all the time, how do you like your job? Like, how do you like what you do? Boston Medical Center, and I've done a ton of things, you guys. I've been a marketing expert for almost 20 years. I worked in the entertainment industry for 15 years. I've had dinner with Denzel and Robert Downey Jr. and been in these really amazing spaces, but there is no job more rewarding than working, than working at Boston Medical Center. And so some of you probably saw in the news in recent days that the Globe was not kind to us. And so if you didn't read that, I'll give you a quick synopsis. For the past 18 months, we saw an incredible number of migrant families coming into our ED, most of them from Haiti, who were escaping just terrible, terrible humanitarian crisis. And so for 18 months, we As families came in, we would first, and we still, assess them for medical needs. As you can imagine, families that have gone through exceptional, terrible odds to get here, through jungles, through disease, through violence, terrible odds. They show up in our ED, and many of them are not well. And so for 18 months, we would assess their medical needs, and most of them were told to come to BMC. Massachusetts is a right to shelter state. They knew that BMC is a Medicaid hospital. They were told to come to us, that we would take care of them. And so we were working very closely with leaders from our city and our state to make sure that there was somewhere for people to go. We were working with community-based organizations really designed to work with this population of people to make sure that there was some place for them to go. So when hundreds of people, literally 30, 40, 50, 100 families per day are coming in through our hospital, you kind of run out of places for them to go. Their social services did not meet the need. So for 18 months, we housed them. We allowed families to sleep in our hospital because it was not our mission to put people out on the street. And so again, working with state agencies to try to come up with other options because we're a hospital. But imagine that if, Boston Medical Center is the #1 trauma center in the Northeast. So imagine coming to the hospital because there's a huge accident, or you're coming in with your child, or you're bringing a loved one for chemo, and you are maneuvering through our ED, and they're migrant families there. It was not sustainable. It was not a situation where we could continue to effectively care for people. So we had to make the hard decision that this is not sustainable. It's not what we could do. Boston Medical Center has always been a beacon of hope for our community, and we will continue to do that. The reporter said that BMC barred families, and we sent them to Logan. So of the over 1,500 families that we saw, less than 2% were ever sent to Logan. And those who were sent there were just because it's the middle of the night. Logan is the only place in town that is open 24 hours, that has security, that has bathrooms, until the next day when they can go get services. So I say all that to say, Boston Medical Center is the best place in the world in terms of providing a mission-driven, community-focused, on-purpose caring for people, by far in the Commonwealth and in the state in terms, and in this country in terms of the work that we are doing focused on health equity. We are the top 20 when it comes to NIH research. 1 in 4 of our patients happen to be housing insecure. 40% of our patients are covered by Mass Health. So 40% of our patients are uninsured, and they are Mass Health eligible. And less than, I think I missed some, and we have a health plan that has over 750,000 members. So again, a hospital that is committed to serve the community. In the fall of 2020, our leaders really started to look at health equity and how we could do something differently. It was in the wake of the murder of George Floyd. It was in the middle of a global pandemic, and we wanted to intentionally do something different. We dug deeper. We looked internally. We had to see where we were falling short. Our organization had to say the word racism. We had to call it out and interrogate it and see how we were going to fix it. We looked internally, and what we found were a lot of disparities. We interrogated the disparities with data back to the root cause. But beyond looking at the data, we also started talking to our patients and to our community, and they gave context to the data. Some of our leaders said, wow, if you look for disparities, they're everywhere. If you look for inequities, they're everywhere. So we were very, very intentional in the looking, and we saw bias. And that's when we started an intervention that was really, really designed to close the gaps. The guiding principles of our work here was really humility. We wanted to be an organization to say, We're not perfect. We serve a population of people who likely in every aspect of their life are met with some sort of a bias or disparity, and we did not want to add to that. So it led to the development of our Health Equity Accelerator. And the Health Equity Accelerator is really designed to close gaps in health equity and to create health justice. Dr. Thea James and Elena Mendez Escobar are leading us in that work. And because of our intentionality, we've been able to close gaps in diabetes and maternal child health. And the next pillar that we are focusing on is economic mobility. So I hope that you guys stay tuned in to the work that we're doing there, because it really is exceptional. Health equity work isn't possible without community engagement. It's just not. It empowers us to collaborate with the community and to achieve equitable health outcomes. I said before that unless you give a seat at the table for community, unless you are engaging them and you understand like what the day-to-day issues are and how they will guide us through trying to help solve for these inequities, then there's a gap in what we can do. If I come to your house, if you tell me, oh, I have a problem at my house, and I come to your house and I just start fixing stuff, and I don't ask you what's wrong, I don't get guidance from you about, how long the problem has persisted, like where it is, then I'm not doing my job. And that is the same with community engagement. We are not doing our jobs unless we have the community at the table to help inform us on how we should be doing our jobs. So before I took this job, I was the vice president of, still worked within BMC Health System, but I was the vice president of marketing and community engagement at our health plan. And so this was, 7 or 8 years ago. And so I met Thea, maybe it was like 9 years ago. So I met Thea, and so as a marketer, I came into an organization that is a Medicaid-based health insurance company, and I was like, how do I do this? Like, I don't have the budget to do these big out-of-home kind of marketing things. The only thing I knew how to do was dig deep into my community engagement experience. And so I visited people. I went to community health centers. I spent a lot of time in community-based organizations. I went to community meetings. I met with community members. And guess what I did? I learned a lot. I learned that, there are a lot of families in the community that between Friday to Monday, they don't have diapers. I was like, I have a solve for that. I can put diapers in every community health center. I can put diapers in, every community-based organization. Yay, I did that. And then they'd say, well, these are food deserts. Oh, okay, that's a food desert. What can I do? Oh, there's a fresh truck that can drive into the community and, give access to fresh fruits and vegetables. Okay, we can do that too. So I was like really, really excited that I had all of these programs that I was able to do. And so I met Thea and I was having a conversation with her. And she said, this is great, but we've got to get to a point beyond charity into equity. So can't have charity into perpetuity. Thank you, yes. And so fast